Welcome back to the Doc Talk podcast. I'm Dr. Sheila Wijayasinghe.
And I'm Dr. Shazma Mithani.
And a special thank you to today's episode sponsor, Figs. So obviously in our line of work, you kind of live in your scrubs. And if you follow us on Instagram, you probably already know this by now, but we're obsessed with Figs. They're super comfortable, breathable, and durable, and they actually fit, which is just a huge upgrade from the horrible itchy scrubs that were the status quo for so long. They're just also super cute and stylish. You feel good wearing them.
Absolutely. Like Sheila said, we are obsessed. But you know what I love the most about Figs? They just get what it's like to work in the field. It's not just that they know what we need, like 7 pants pockets to carry all of my stuff on shift, but they've also built this incredibly supportive community of people who want to have important discussions and make real connections with other people who work in healthcare. I've been lucky enough to go to some of their events and they've done such a good job. It's so refreshing for a brand to show up in such a real way. And you guys, if you're not already following them on social media, the memes are so great. If you work in healthcare or know someone who does, Figs is it. And right now, if you go to wearfigs.com and use code FIGSCA, that's FIGSCA, you can get 20% off your first order. That's wearfigs.com, code FIGSCA.
So today we're breaking down something that we both see in the clinic and in the emergency room, blood clots, specifically deep vein thrombosis, or DVT, or pulmonary embolism, or PE. And this was motivated from a question that we got from our listener, Jessica.
Hi, Dr. Shaz and Dr. Sheila. My name is Jessica. I love your pod. My question is, I travel quite a bit and I'm worried about the risk of blood clots. How much do I really have to worry? And is there anything I can do to help prevent them?
Thanks so much, Jessica, for this question. This is such a great question, something that I certainly hear a lot from friends, from family. I myself travel a lot as well. And so these are conditions that can actually be quite serious and even life-threatening. But the good news is that most people have no idea how preventable they can actually be.
So we're going to walk you through this because it's important to understand what blood clots are, who's at higher risk, what symptoms look like, and when to get help, and what the treatment usually involves. So let's start with the basics. A blood clot is your body's normal way of stopping bleeding when you're injured. So the problem happens, though, when a clot forms in the wrong place at the wrong time.
And this is such an important distinction, Sheila, because a lot of people think that clotting is bad. Clotting is good because if clotting didn't happen, we would just bleed. So in conditions like hemophilia, for example, patients are not clotting effectively and they can bleed to death even from a small or minor injury. And so clotting is good, but like you said, the issue becomes is when that balance or equilibrium is off and there's more tendency to clot versus breakdown clot. And so a DVT is a clot that develops in a deep vein, usually in the leg, and these clots can stay local. So they typically cause some pain and some swelling in the lower leg, but they become a concern when they actually can break off and then travel up to the lungs.
And this is where the worry comes in, right, Shaz? When I see somebody in the office who has a swollen leg and I'm worried about DVT, certainly I'm worried about the clot that's in their leg, but I'm worried more that this clot could travel up to their lungs and cause something called a pulmonary embolism or PE. And the PE can block blood flow to a part of the lung, which is why it can become so severe and life-threatening so quickly.
Absolutely. So it's kind of I like to equate it to a traffic jam in the circulatory system. So that blood gets caught in the blood vessels of the lung, and then it prevents any oxygen from getting kind of downstream of that. And so that's when we start getting issues with parts of the lung can die. And if that clot is actually big enough, that heart can no longer squeeze against that high pressure from that blood clot kind of getting in the way, and it can cause significant heart issues as well.
So let's talk about who's at risk here. So because we know that risk isn't evenly distributed between our different patients, and some people may be more prone to developing a blood clot than others are.
Yeah, and that's a really good point because there are these really big categories that put people at risk. And the biggest ones are immobility, so not moving, and inflammation. So things like long travel, Jessica asked about that in the listener question, prolonged bed rest, if you're recovering from a surgery, for example, hospitalization, actually having surgery as well, and a cast on your leg. All of these things can slow down that blood flow and then trigger a clot to form.
Absolutely. And we also know the impact of hormones as well on blood clot formation. So certainly around the time of pregnancy, postpartum, estrogen-containing birth control and hormone therapy can increase the risk of clots. We know that there's certain types of therapies that are less likely to cause that increased risk of clots as well. We talk about that a little bit more in our perimenopause segment that we did in season 1 as well. So you can take a listen to that in terms of the risks of clotting with certain hormonal therapies.
Then, there are other risks as well, like cancer, and cancer treatments are major risk factors. And so chronic illnesses in general can cause this like general systemic inflammation. Inflammatory bowel disease is another example. And so these things actually just generally increase the inflammation in the body and then can also trigger that clotting pathway and lead someone to be more prone to blood clots.
And that's a really important point, Shaz. And it's interesting. A lot of patients will ask me, like, what can I do in my lifestyle to decrease my risk of clots, especially those who may have an increased clot risk because of those other conditions that we just went through.
Mm-hmm.
And lifestyle, we know that lifestyle does play a role in terms of your clot risk. So things like smoking, dehydration, having a higher BMI, long sedentary periods can all contribute to increasing clot risk as well.
And there are inherited kind of clotting disorders as well. So these are kind of disorders in the clotting pathway. They don't necessarily guarantee that you'll get a clot, but they certainly can increase your baseline risk of getting a clot. And then, of course, Sheila, as you mentioned, some people may not just have one of these risk factors. They may have many of these risk factors that would certainly kind of compound and increase the risk of clot altogether. And so it's important to like have these conversations with your family doctor, because if you are someone that's at increased risk of a clot, they may then have a conversation with you about how your lifestyle can play into things, whether there's certain medications that would put you at increased risk of clot as well. And so making sure that your family doctor knows about those things means that they can approach you in an individualized fashion.
Absolutely. I appreciate having those conversations because it does influence our treatment decisions. So Shaz, let's get into what people can look out for and what symptoms to pay attention to when it comes to, am I actually having a clot or not?
So let's start with DVT. So a DVT is a blood clot in the leg. So typically the symptoms that we're going to see is swelling of just one leg, because it's very rare to have a clot on both sides. And so it's usually swelling of one leg, some pain, redness, kind of this heaviness and warmth. And sometimes the skin can kind of look stretched and shiny as well because of that amount of swelling that is being being had in that lower limb.
Yeah, and what you said also, Shaz, is really important in terms of like, it's usually unilateral. So it's one-sided. If both legs hurt after you've gone for a run, that's not a DVT or a clot. But if one side is swollen, painful, and sort of out of nowhere, it's become swollen and painful, that deserves more attention.
So what about PE, Sheila? So this is a blood clot in the lung. What are the symptoms that people should watch out for?
Yeah, so this is a big one, and pulmonary embolisms or PEs can look completely different. So you'll see like a sudden shortness of breath, chest pain that may worsen with breathing, coughing, sometimes coughing up blood. You can get dizzy or you can feel like you might even faint.
Mm-hmm. And so people often describe this as like a deep, sharp pain when you take a deep breath in. And there's often this feeling that they can't get enough air because that pain is really restricting their breathing. Sometimes the only symptom, though, so you may not have chest pain, may not have shortness of breath. Sometimes the only symptom might be a fast heart rate and just like feeling off.
And these are symptoms not to watch and wait with. Shaz, these are things that I want my patients to go and see you for. Like this is a 911 situation or an ER visit.
Absolutely.
So now we know what to look out for. Why are clots dangerous, Shaz?
So this is a really great question because there's, a clot in the leg or a DVT is typically not dangerous. Very, very rarely, if that clot is really big, it can block off blood flow and cause permanent damage and cause what we call ischemia or like a lack of oxygen to the leg. But this is like exquisitely rare. The bigger thing with blood clots in the leg is if they break off and they can travel to the lung and cause a PE.
Yeah, and this is dangerous because this can impair your body's ability to oxygenate your blood. And also a large PE, which you alluded to earlier, Shaz, is that it can put a lot of strain on the heart and cause collapse of the lung, but also just put strain on the heart, which can actually then lead to potential death. And this is where this is really important to get that help very quickly.
Absolutely. And it's tough because the severity of PEs really ranges a lot. So some PEs are really small and kind of like on the very outskirts of the lung, and they typically don't cause any issues. The general accepted consensus is that a lot of people walk around with small PEs and don't even know about it, right? But if the PE is kind of closer to the middle of the blood circulation where it can have a bigger impact, that's when they can actually cause significant issues with what you just talked about, that heart collapse or that, like I mentioned earlier, that kind of decreased blood supply to the lung, and they can become a big issue and become life-threatening.
And this is why we take symptoms so seriously. So when someone presents to our family practice office and we worry if PE is on our list of possible diagnoses that's causing them to feel the way that they are, this is not something that we manage as an outpatient. I'm sending those patients into the emergency room for a proper workup because they don't always present dramatically, right, Shaz?
They don't. And unless it's like a tiny PE, most of these patients actually will, they will be started on a blood thinner and will need to have like kind of serial outpatient follow-up to make sure that things were going well. So this is not a minor thing. It's absolutely a reason to come to the ER.
Absolutely.
So Sheila, when you're seeing, I mean, if you know that someone has an increased risk of blood clots, what kind of things are you talking to them about in clinic in terms of prevention?
Yeah, so this is really what we do in family practice is we know our patients well, we know what your health conditions are, and that helps me decide with you what medications are most safe to be on. So if somebody has a predisposition to a risk, like a clot risk, then I'm going to choose medications that aren't going to increase that clot risk. Specifically in my patients who are looking for contraception, we may then consider a progesterone-only option, for example. And prevention is generally quite straightforward in terms of like the simple things that we talk about. The biggest one is movement. So if you're traveling long distances or sitting for hours, make sure that you're getting up, walking around, and stretching your calves.
I think this is a really important one. I mean, like, so if I'm just flying, like, from Edmonton to Toronto, it's about a 3.5 hour flight. Like, I'm for sure getting up at least once during that flight. And so that's fine. Like, as long as you're getting up every 2 to 3 hours, but it's those long haul flights that where especially if you're like sleeping on a flight, if it's like an overnight flight, that you will often forget to do that. And so it's important to remember to get up, to walk around. I usually set a little alarm on my watch and kind of get up, stretch my legs, do some calf raises just to get blood flowing again. Hydration helps too. And so dehydration is actually very common with airplane travel, and it can thicken the blood and increase that risk of clot too in people who are already vulnerable. So important to stay well hydrated too.
Absolutely. And then for those with a higher baseline risk, if you are at higher risk to start and you're about to go in for surgery for any reason, or you're hospitalized and maybe immobilized, or right after having a baby, for example, we may actually offer you blood thinners because you are at higher risk at baseline, and you may be higher risk even more so after any one of those procedures. And so in that situation, that's why knowing your history is really important, knowing your family history is really important, because then we can proactively take steps to decrease your risk of clotting as well.
Another great preventative option is compression stockings. So these will help in specific situations. So like long haul flights, I always throw on my compression stockings during long haul flights just to help with that prevention, or recovery from surgery, for example. And so this is something that where we would consider recommending this to people who are at higher risk or are going to engage in a high risk activity. So whether that's a long haul flight or something that where they're going to have a surgery and might be immobilized for a period of time, those compression stockings are going to be helpful. Another thing to consider to talk to your family doctor about is potentially using baby aspirin before flights. Now, this is not something that you should just do without talking to your doctor, because there are risks associated with this as well. And so it's important to have this conversation with them before a long haul flight if you're someone that may be a candidate for being on baby aspirin before a flight to help lower that risk a little bit more.
And I mentioned the estrogen-containing birth control pills earlier, but if you're on one of these pills and you develop new risk factors, or you develop a clot while taking one of these pills, it's worth revisiting if this is still the safest option. We have many options available to you that don't have the same increased clot risk, so something else can be offered to you that is a safer option. So Shaz, if I'm sending someone over to you, I'm worried about a DVT or a PE, how do you diagnose and how do you treat in the emergency room?
So when it comes to DVT, it's usually someone who's either presenting with the symptoms that we talked about, so like swelling, redness, pain in one leg, or a family doctor has recognized this and is worried about a DVT and is sending the patient in. And so the gold standard is an ultrasound of the leg. And so what is done is the blood vessels are looked at with this ultrasound that will take a look and kind of see if there is a clot there. There is a blood test that can be useful in low risk patients called a D-dimer. So this is for only low risk patients. And it's kind of like a screening test where if it's negative, it's really helpful. And it says with a fair level of certainty that they don't have a blood clot. But if it's positive in a low risk person, then you would then move to imaging. So like with an ultrasound for a DVT.
Right. And for PEs, why I send my patients in to the emergency room, because sometimes I can get an ultrasound for a DVT as an outpatient, and I can get it within a short period of time. But for a PE, the real gold standard is to do CT imaging of the lungs. And that's really why we send people straight through to the emergency room, because that's a test that we can't wait for and it has to be done urgently. And if someone can't get a CT scan for any other reason, there are alternative options available.
Yes, there's something called a VQ scan or a ventilation perfusion scan that can be used in pregnant patients, or, it is a bit lower radiation. So we'll often use that in younger patients who have otherwise healthy lungs. But usually the gold standard in someone who, where we're worried about a PE, or if they have underlying lung issues, is just going to have a much better view of those blood vessels with the trade-off of having some higher radiation is that CT scan.
Tell me about treatment, Shaz.
Yeah, so the main treatment for both DVT and PE is a blood thinner or anticoagulation. So these medications, they don't dissolve the clot, but they actually allow your body to dissolve the clot without allowing it to get bigger. And so the reason that the blood thinner is important is that it prevents that clot from growing. So once there's already a clot there, the body tends to build up more clot on it. And so that blood thinner thins the blood, prevents that clot from growing bigger so that your body can kind of shrink the existing clot on its own and start to break it down.
And prevent others from forming as well.
Exactly.
And how long you stay on a blood thinner really depends on the type of clot that you have in terms of, was it provoked by something temporary? So were you immobilized? Was it after surgery? Or was it something that just happened and we didn't have a reason for why it happened? And so that is part of the decision-making tool that we understand. So we really have to understand, was it provoked by something or did it just happen spontaneously? And that will change the duration of treatment on an anticoagulation treatment plan that we have for you.
For sure. And I think another important thing to remember is that there is one other medication that we use for very severe PEs. So these blood clots in the lung, if they are starting to cause like effects on your heart or effects on your lung that could potentially become life-threatening, there's a more aggressive treatment called a clot-busting medication, or sometimes a catheter procedure where an interventional radiologist will kind of like feed a catheter through all the blood vessels, get to that kind of target that clot area, and then inject kind of a clot-dissolving medication. And the idea is that this does actually dissolve the clot actively. Now, this is just a small minority of cases, but important to keep in mind as like another medication that we would use in very severe cases.
Oh, that's so interesting. That's amazing how they do that. Actually, like the technology around that is incredible.
It's really neat.
It's amazing. As an outpatient, so when patients are seeing me in the office, there's many different options that we use for anticoagulation or for thinning the blood out, basically. There's older options like warfarin. It's also known as Coumadin. That needs regular monitoring of your blood. And this is one of the things that can be difficult for patients to do, is to have that regular blood monitoring to check the blood thinness and make sure that you're not too thick, basically. And that test is looking at something called the INR. And what has really replaced a lot of use of warfarin is a newer agent that's called the direct oral anticoagulants, or DOACs. And these do not need monitoring of your blood. And so certainly some patients need to be on warfarin because they have specific conditions that don't allow them to be on the newer agents. Cost can sometimes be an issue in terms of if you're covered or not for these medications. But right now, a lot of the times we're using these DOACs that do not need monitoring.
And I mean, that's certainly like, unless there's a contraindication or reason that a patient can't be on that medication, that's almost exclusively what I'm starting in the Emerge when I diagnose a DVT or PE. A gentle reminder, once you are on these medications, do not stop them without consulting your doctor. I've had so many patients come in where they, there's some sort of a misunderstanding where they think they're only supposed to be on a medication for a few months, but then they stop it without talking to their doctor and then end up having another blood clot form. And so it's really, really important to talk to your doctor before you stop any of these medications once you've been started on them.
Okay, Shaz, let's talk about the top takeaway points for healthcare workers on clots.
Yes, this is an important one for sure. And we have a lot of healthcare workers who are listening, so this one's for you. So number one, don't anchor. Even low-risk patients can have DVTs and PEs. And if the story fits or something feels off, be sure to widen your differential.
Number two, tools aren't the holy grail. So things like Wells, Perk, years, they help you, but your clinical judgment matters more. Think about what your patient looks like in front of you and judge accordingly.
And number three, D-dimers are not the be-all end-all. Remember that D-dimers are helpful in low-risk populations, but in moderate or high-risk populations, even a negative D-dimer is not helpful. You need to work them up further for a blood clot.
So blood clots can be scary, but they're also one of the conditions where knowing the symptoms and acting early makes a difference.
It's important to pay attention to symptoms like one-sided leg swelling, unexplained shortness of breath, sharp chest pain when breathing, or anything that doesn't really feel quite right. And
if you're high risk, prevention really does help.
Thanks for listening, and we'll see you next time on the Doc Talk podcast.
And thank you for everyone for tuning in to the Doc Talk. A reminder that the Doc Talk is for general information purposes only. The podcast is not intended to replace medical advice from your doctor. While we are doctors, we are not your doctor. Always speak to your own healthcare provider for questions related to your personal health needs.
And make sure to follow us on social media at the Doc Talk Pod. Be sure to like, subscribe, and review us wherever you get your podcasts.